really important for what we're dealing with here, what we're up against. This is the Peninsula Daily News. This is an article from a few days ago. Barry, that's Allison Barry. She is the public health officer. Not sure how she got the position, but she seems well. Let's learn about Dr. Allison Berry today. It feels like the dam is breaking. So here we are again. The surge, the same old hyperbolic rhetoric that we've been hearing for a year and a half that has not panned out. It certainly has not panned out in this community, and I don't think it's panned out anywhere. But not here. The hospital never filled up. The little tent they built, and all this they did, and all this rigmarole, and it didn't amount to anything. Let's read. The current COVID infection rate on the North Olympic Peninsula are mirroring the surge seen in the 2020 Thanksgiving holiday season. Again, nothing. I know a bunch of people who got COVID then and throughout COVID. They were fine. Many of them, if not most of them, had no symptoms. There was no point, again, where the hospital was filling up. There was any danger of overwhelming the local medical, the capabilities of the local medical systems. That never happened. So the surge was, even the great surge of Thanksgiving 2020 was nothing. It was no worse. It certainly wasn't as bad as H1N1 around here. I don't know if y'all remember that. Anyway, and officials are struggling to keep up with contact tracing. So I'm going to get back to that. At this point, it feels like the dam is breaking. I mean, she can't even come up with a creative metaphor. It's a dead metaphor, Allison. That's the best you can do, said Dr. Allison Berry, health officer for Jefferson and Clallam County. Two very old counties, by the way, where you would expect from something like this, such as H1N1, a large number of deaths. We'll see how many we've had here in a bit. Due to the high level of cases, local contact tracers must rely on help from the state, Barry said. We have numerous outbreaks throughout the blah, 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 workplace. It's not just travel related anymore. Don't know what that means. I don't think she knows what that means. I don't, also, without getting too much into it, contact tracing is basically impossible. I work with a lot of data. It's impossible to determine where somebody got infected from. And it gets, once somebody's been exposed to, 5 or 10 people, it's like the number of possible iterations of that are massive. Anyway, moving on though, whatever. We don't have adequate contract tracing capabilities for all the cases that are coming in, she continued. We are prioritizing cases that are high risk, cases in healthcare setting, blah, blah, blah. The rest of the cases are being sent to the state. She continued, we are reaching the limit of contract tracing's ability to control infection. Okay. Clallam County can for 15 new cases of COVID-19, right? There's like 80,000 people in the county or something like that. 15 new cases. Oh no, and everybody's probably fine. Clallam County case rate rose to 209 per 100,000, 2 weeks, blah, 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 recorded in November. Oh, there we go. The great surge of November. The great nothing. Jefferson County, blah, blah, don't care. Although I'd point out, the cases are higher now, and over half this county's vaccinated. So the case number is higher than it was before mass vaccination. Okay, you do whatever you want with that information. Dr. Allison Airhead here, she thinks that we need more contact. Well, we'll see what she thinks we need more of. But cases are rising as vaccinations are rising. Okay, that's happening. You got to come up with a reason why. I'll let you do that. I can't. I'm not a scientist. Community mitigation measures such as mask wearing, limiting indoor interaction, and social distancing are needed in addition to contact tracing to slow the spread of the novel coronavirus. So Allison Berry, who is somebody of very few accomplishments, I don't believe she's ever owned her own practice. She's never opened a business. She wants to shut down businesses again. She wants to muzzle children. She wants to. Go back to where we were last winter. Let's read that sentence again. We are going to keep fighting it. Let's read this next one. We are going to keep fighting it, Barry said. We are not giving up. Certainly our staff are frantically contract tracing as we speak, but we are reaching the limits of our ability. Now, let's examine that. What she's not saying that the healthcare system's overwhelmed. She's not saying doctors and nurses are overwhelmed. She's saying that she's has too much paperwork. She can't deal with all the paperwork she's got to deal with. That's why we need to close businesses, because this bureaucrat can't figure out how to do their job in their cloistered, protected little setting. She can't push the paper around fast enough, right? So she wants to say, oh, you builders, oh, you that are feeding people, you that are actually doing things, making things that are actually useful members of society, you have to stop. You have to stop working. You have to put your kids in a freaking face diaper because I can't deal with all the paperwork. Okay, I'm not making this up. This is her words. That's a quote. We're reaching the limit of our ability. Something must be done. So there are currently discussions about state and health officers about what mitigating measures they might impose, but no plans have been made yet. What they're going to impose, again, what we know. The muzzling of children, the closing of businesses, because Dr. Allison Berry can't keep up with her paperwork. This should, whatever. We've gone through this. We're a year and a half into this. Nobody listened. I told y'all don't even give up 2 weeks. Whatever, okay. Hindsight's 2020. But you all see this now. And please note, the reason that you are going to be locked down is because Dr. Allison fucking Airhead cannot keep up with her paperwork. The majority of new infections are among unvaccinated residents. I'm not sure about that. The hospital just had an outbreak of vaccinated hospital staff, with about 8% of the cases since mid-January. Okay, so they got to go all the way back to before the vaccine was available to get that low number. And with vaccinations going up, if you're having to use that far of a sample, you actually have to go back where all hospitalizations would have been, or new infections rather, would have been unvaccinated, because there were no vaccinations. That's a skewed number. Okay, nobody's just stupid, Dr. Allison Airhead. Breakthrough COVID, blah, blah. Barry has been 12. Okay, urging all. We don't care what Barry says. Of course they've been urging the vaccination. Why? Who knows? Because she'll follow the agenda. She'll do whatever she's told. She has no morals. She has no brains. She has no work ethic. The vaccination... There's all these breakthrough cases. You got to finagle with the numbers to make it seem like the vaccination is working. Allison Berry, why don't you do July? So you're going to find out that the vaccination rate and the COVID infection rate are probably somewhere in the neighborhood of the same. It's not 8%. You got to use that skewed number. It's so dishonest. It's disgusting. And blah, blah, Jefferson County. Things are getting quite serious quite quickly. We are really going to need the whole community to come together to get it under control, said Dr. Stupid-ass Airhead. We can do it. We've done it before. So you see what they want to go back to. This is what we want to go back to. And this is typical of public health officers everywhere. They're lazy bureaucrats with way too much power, and who think that your business should close so they don't have to deal with so much fucking paperwork. Y'all can put up with it. If you can fucking put up with it, put up with it. 17 people have died from COVID-19 in Clallam County, and 4 have died in Jefferson County. These are 2 of the oldest counties in the state, 2 of the oldest counties in the country. I think Jefferson County is like 4 or 5 in the country or something like that. Maybe it's a little 10th or something, but it's a very old county. And there's somewhere around 100,000 people between these 2 counties. 21 people have died with a COVID diagnosis in the last year and a half. They're not died of COVID. Right, we all know they like to play around. Anybody with a COVID diagnosis, Dr. Allison Airhead likes to say, "Oh, it's a COVID death, everybody! Hey, COVID death, everybody! Look out! Oh, COVID! The dam is breaking." We all know, though, that these were, and as far as I can tell, every single one of them was somebody who was very old, compromised health, on the edge, and of course these are unfortunate, but talk to her. She's the one that throws a party every time someone dies with a COVID diagnosis. But still, 21 people. And we got Dr. Allison Airhead, because she doesn't like dealing with all the paperwork.